So hospitals have found themselves with a huge footprint of data across their infrastructure that they have to maintain for regulatory compliance, research, clinical care, all sorts of value driven as well as regulatory driven reasons to support billing, to support population health initiatives. So MediQuant really helps our customer understand what data they have, what value that data has, how they will preserve that value both from a look back perspective and protecting the investment they made in that data, so protecting the dollars that they got paid for that care, protecting maybe grants and other initiatives that they have that data supports, as well as looking forward. How do they plan for the future? How does the data help them predict what kind of investment they need to make in IT and clinical care and in clinical structures, physicians, staffing models, all those kinds of things. So we really protect the data so that the customer can continue to support those initiatives without having to rely on many different footprints, many different databases, many different structures that maybe where the data is obfuscated or it's not quite as clear. We help bring it all together into one platform. We save the data for them and then make sure that the data is available for the future. So our customers are able to reduce costs. That's the number one thing that they're able to do because they can retire old hardware, they can retire old software and infrastructure. We also, of course, protect risk because they have access to data that they otherwise may lose if they lost hardware or software or other items. So then strategically, we position them for proper data management into the future. So we all know that data has value, and we don't even really know exactly what kind of value it's going to continue to provide into the future as new technologies, new reporting techniques, maybe even new care techniques, new research comes out. We enable our customers to be able to pull into all of the old data that they've collected over the years and drive those initiatives, drive those efforts, and perhaps even monetize that data into the future.